Now, one of the issues that's come up since CAR's been commercialized, we previously manufactured the CAR cells on site ourselves for our patients, and now there's a global distribution chain, and there are product release criteria that must be met before a product can be released to treat a patient. One of the release criteria that's been problematic has been viability. In the USA, the FDA has settled on a viability release test of 80%. That means when you thaw the cells and the product that you're going to infuse into the patient, at that thaw, greater than 80% of the cells will be viable. That is, they are not dead cells. They exclude trypan blue. There's a couple tests that can be done for that. In any event, that release criterion, which had been based on the first registration of the drug for pediatric ALL, was adopted for adult lymphoma. And it's not uncommon for us to get products that are between 70 and 80%. In our own trials, that was the release criterion, greater than 70%. And in fact, in Juliet, greater than 70% was the release criterion. That was a registrational trial. But somehow in the US, 80% was what was mandated, and so therefore many patients were not getting products released. It's unfortunate because the data we looked at, and this is the data that we summarized in our recent letter to Blood, was that patients between 70 to 80% viability have the same outcome, indeed the same expansion in vivo of the cells as well as clinical outcome as those that are greater than 80%. So I have to tell you that the rest of the world, the EU included, uses 70%. Israel uses 70%, above 70%, and Japan uses above 70%. I believe Australia as well. I think the United States is the only place where we have this issue. And I have written a protocol to use these so-called out-of-spec products and submitted the findings to the American Society of Hematology meeting. We'll present them in December of this year. Again, those results look like the products that are above 80%, and I'm hoping we can turn over that release criterion in the United States. Other release criteria like increased interferon gamma secretion by the cells, less than the lower limit for cell dose, are again parameters that are used not to release a product. We've treated patients outside of those two limits successfully as well. It's not very common that that happens, and when it does, we generally petition the FDA, or we have a study that we can go ahead and treat patients. So these release criteria are important, but we don't know what the lower limit is.